Hey everyone, today we are going to discuss regarding lobular carcinoma of breast. So we are going to capture all the important features of lobular carcinoma in situ as well as invasive lobular carcinoma. So please stay tuned till the end of the video and we are going to capture all the important points and just jot it down. So lobular carcinoma in situ presents as an ill-defined lesion. Both invasive carcinoma and lobular carcinoma in situ presents as an ill-defined lesion. Lobular carcinoma in situ will have microscopically there will be a lobular expansion by monomorphic cells, whereas invasive lobular carcinomas they will have a single-stranded pattern, single file pattern, or we call it as an India file pattern, and that results in desmoplasia and spread of the tumor into the stroma. And many other variants of invasive lobular carcinoma may be there, that is solid variant, signet ring cell variant, alveolar variant may be there. Lobular carcinoma in situ has to be treated with observation if it is an incidental finding, and if core biopsy we have to do, and if there is an ATP it has to be proceeded with surgery and hormonal therapy. E-cadherin loss is seen in both lobular carcinoma in situ and invasive lobular carcinoma. And E-cadherin is an intercellular adhesion molecule that is encoded by CDH1 gene that is located on 16q. Invasive lobular carcinomas, on the other hand, this single file pattern is there, and that will generally lead to widespread dissemination of the tumor cells. It spreads by the blood-borne route, and metastasis to distant organs like CSF, serosa, and ovary is seen in invasive lobular carcinomas. Invasive lobular carcinoma of the breast is second most common cancer after invasive ductal carcinoma (NOS). And important thing is that it has to be treated with surgery and standard surgery of MRM, and radiation chemotherapy and hormonal therapy has to be decided based on the stage and case to case basis. So these are some important aspects of lobular carcinoma in situ as well as invasive lobular carcinomas. Now let's capture some important points that we learned today. Lobular carcinoma in situ and invasive lobular carcinoma both present as an ill-defined lesion without microcalcification. Invasive lobular carcinomas present as a single file pattern, and distant metastasis to other organs are fairly common because it spreads by blood-borne route. CSF, ovary are commonly involved by invasive lobular carcinomas, and invasive lobular carcinomas have to be treated with standard surgery, and chemo and hormonal therapy have to be given. Thank you. Thank you for watching the video. Please subscribe to the channel, hit the bell icon, and follow in our different groups. And please stay tuned for the next video. See you in the next video. Thank you.